YouTube you. Woo! Mr. King coming at you live. Today, we're going to be talking about vital signs. So, at the end of the day, you should be able to answer, what can patients' signs and symptoms tell us about what's happening in the human body? First, we're going to start with the heart. The heart is currently the most important organ in health, just because the #1 killer in the world is heart disease. So that's why a lot of times when you get your vital signs, you're going to focus on the heart. So first one is pulse. Your pulse is a measure of how many times your heart beats per minute. And try and think, what is the heart actually good for? So your heart, you may be thinking blood. The main thing that your heart does, is pump blood through your body, and blood gives your body the oxygen it needs to survive. And oxygen is super important. It gives your tissues the energy it needs. If you're not sure how important oxygen is, just hold your breath and you'll see why. But the main thing is the blood carries oxygen and the heart pumps the blood so the whole body has oxygen. Okay, and you may have noticed that after you exercise, your heart is going to be beating really fast. And the reason is because your muscles need more oxygen. And then next, after pulse, your doctors will get your SpO2, which also stands for the oxygen saturation of your blood. So, it's basically a count of how much oxygen your blood is carrying. And your goal for SpO2 is to have 97 or above. Temperature. So the doctors will also give you temperature. It's usually around 98.6 degrees Fahrenheit. And you may be thinking, why do they even care about your temperature? Well, when your body is sick, it's often trying to kill the bacteria or virus by raising your temperature. So it's a response usually to infection. So if you're really hot, then that could be a sign that your body's trying to fight off something. In the class, we use disposable temperature, and we usually put it under the ton. Next, after temperature, we did respiration rate. Respiration rate is breathing. Okay? So, what we did in the class is you have someone sit down, and then you put your hand on their shoulder, and you count how many times their shoulders rise and fall to count the breaths. And then the reason why we care is because if someone's really breathing heavy, it can mean they have something in their lungs. So a lot of breaths, over 20 a minute, is usually a bad sign that they're winded or that their body needs more oxygen. So that's why we get breaths rate. 12 to 18 is usually the goal. Higher can mean that they're in distress. Last one is blood pressure. Blood pressure is how hard your heart has to work to move the blood all over your body. And the higher your blood pressure, it could be your heart is working too hard and it's a warning sign of a heart attack to come. Yep, so that's why we do blood pressure. And that is the last vital sign. Your blood pressure is usually going to be around 120 to 80. And anywhere from 100 to 140 really is okay for the top. And then 70 to 90 is okay for the bottom number. But you really don't want anything over 140. If your blood pressure is typically over 180, that's really a big sign of distress. So you may want to consider going to the hospital. Thank you so much everyone for watching the vital signs video. I hope you enjoyed it. Have a great day.